This is our exam room. So typically we'll meet our patients in the emergency room or in a consult room out by the ED, but then we'll bring them back here to do the exam. We are the only ones, I feel like, who understand what we go through. We're the only ones who understand what our patients go through. So this is the kit that we use. It is a Maryland State Police universal kit that all SAFE programs will use.
Sometimes we do see patients who come in on the most traumatic time in their lives. So just being able to hold their hand and be with them and just let them know that you believe them, that everything will be okay, and that you will help them through the process is really rewarding. A SAFE nurse is a registered nurse that is specially trained in forensics, and we treat patients across the lifespan who have been victims of domestic violence, sexual assault, children who have been sexually and physically abused, human trafficking patients, so just any kind of patient that comes into the hospital who has suffered a violent crime.
SAFE nurse, for the acronym, is Sexual Assault Forensic Examiner.
So this is our crime cam. This is what we use. It's a specialized camera that's used to document all of the injuries that we might see on one of our patients. It is really difficult at times because you are with the patient right after one of the most traumatic experiences of their lives. So sometimes it is hard to separate and not take it home with you. I found that reaching out to my team is really helpful. We all have really bad cases and we just need to talk to each other sometimes about that, so that's very helpful. And just seeing what our work can do for someone just makes it so much more worth it.
I have currently been a nurse for 13 years. I've been at GBMC my entire career. As I worked here at GBMC, I did become aware of the SAFE program, and it kind of intrigued my interest. I think it's amazing, the support that we have in the program. There's 17 of us nurses, 5 advocates, and this is like no other type of nursing.
I was in the integrative care unit. We saw a lot of psychiatric patients. So I started to see this connection between my patients who were there for psychiatric conditions and they had a history of some kind of assault or abuse or some kind of violent crime in their past.
We have a fantastic relationship with Baltimore County Police, with the SVU detectives, and we all work collaboratively. Our collaboration with Baltimore County Police is usually more in the acute, the interim, where we get the patients from Baltimore County Police, or the patient comes here to us, and then we ultimately contact Baltimore County Police to come out and begin their investigation to start their report. So first and foremost, we usually work with the patrol officers that would bring a patient to us, and then we work with the SVU detectives that would come here and meet with the patients.
Yeah, it is hard to separate sometimes because you are with the patient when they're recounting one of the most traumatic events of their life. So sometimes it is hard because you feel like you're living it with them.
Often people will say, I don't know how you do what you do. And we do it. One of my passions is pediatrics. In all of the patients that we take care of, I feel like pediatrics, they are our most vulnerable population. If we get a child that has made a disclosure for sexual abuse, or whether it's just a suspicion of sexual abuse, we are their advocate, we are their voice.
So our families have to be really supportive. They didn't really choose this job, but they're accepting of it, absolutely. So it's really helpful, especially for some of us that have children. Sometimes we have to leave in the middle of the night and with very little notice.
Before I started pediatrics, my kids didn't really know what I did. It was kind of one of those things where the phone rang and mommy had to go to work, and I didn't really talk to them about it. Then I took care of my first pediatric patient here through GBMC, and that child at the time was just about 6 months older than my youngest girl. And I went home and I remember saying, I haven't quite processed what I had to do yet today, but I knew that I needed to talk to my kids. I knew that this was a conversation that every parent has to have with their kids, but you don't want to.
So with our patients, before we leave, our most important goal is just to make sure that they're safe. So when we clock out and leave the hospital, our work really isn't over. So we want to make sure that they have a safe place to go and they have all the resources that they need in order to stay safe in the future. So we encourage all of our patients to call our program anytime that they need help, day or night, and to get some assistance. Every patient that we see, they never ever receive a bill. And it takes a lot of support from our community to be able to fund these exams, and so we can continue to see patients without them having to receive a bill.
Just have someone to lean on, because we do see patients in in trauma, and we see them, like I said, on the worst day of their life. So to be able to bounce that off of our fellow nurses is huge for our physical and mental well-being.
It's really rewarding when your patient thanks you for what you did for them, even though if you think it's just a simple thing as holding someone's hand and saying that you believe them, it's really comforting to that patient.